So now we're going to do another PPP, your pre-patient procedures. Reminding you again, these are things that I need you to do and become proficient at before you do it in the patient's mouth. You'll do 10 of each of these PPPs before you get in there. Today, this one's going to be on rubber dam placement. I'm going to have you place rubber dams in the patient's mouth before I come in. And so we'll get them all numb, and even on the top I'll numb them and have you come in, and you'll put the rubber dam on before I come back. So, okay, let me show you. Come on down here. Okay, so the first thing you want to learn is the clamps. Okay, that's the biggest learning curve, is figuring out which clamp to use. First one here, and I'll scoot it forward. That one is for your anterior teeth. Okay, canines, laterals, and centrals. Okay, is that one. Now it kind of leans back. If you look close, this side is farther back, so that side goes towards the tongue. That's to the lingual. This towards the lip. Okay, to the facial side. That just gives me better access from that side. Okay. Next one is for premolars, maxillary and mandibular, top and bottom premolars, and you can just see that one. You can just see how it's shaped about like a premolar. Okay. The next one is for molars, for the mandibular molars. Only lower molars is this one. Okay, and it's just shaped just like them. They're pretty evenly shaped teeth, and that's the guy you use. Okay. Now this one is for maxillary molars, and this one's you want to be a little more closer in on, because that tooth, if you look, this side has these little grooves in it, little teeth in it, and this side is smaller than this side, right? See how wide that side is versus how small that side is? And the reason is because a maxillary molar, this one's used for maxillary molars, upper molars only, and this smaller side of it goes to the lingual part, towards the palatal root, towards the lingual tongue side, because that side's skinnier. So on a maxillary molar, this goes buccal, that goes lingual. Okay. All right, that's actually the one we're going to use, is that one, that tooth to place in there. Next thing we want to show you is this. This is a rubber dam. If you look close, it kind of has a sharp edge on the front here. Okay, back side doesn't. It's nice and smooth. That smooth side goes towards the patient's face, like so. This stays out. Okay, and the reason is that stuff will hurt you. I've had patients where we've had it on the wrong side and it rubbed their lip wrong, so make sure that comes out. Okay. All right. Now this punches the hole in the rubber dam. Okay, and if you look kind of close, I don't know if you guys can see that. That little tool has different sizes of holes on it. Okay, and you can change them. I just use the biggest size. Always put it on the biggest size. Okay. And this is what you grasp the clasps with. Okay, so if I actually come down here on one of these, it actually fits in the hole. Okay, like that, and fits in the holes, and then you squeeze it. As you squeeze it, stretches it. Okay. All right, I'm going to leave those aside because this one we're going to use. Now, come on down here where you can kind of get on top, you guys, so you can see. Now, there are really typically 7 teeth per half quadrant. So we got 14 teeth on the maxilla. We got 14 teeth on the maxilla, 14 teeth on the mandibular, right? 7 a fourth. We have 8, but the 8th is the wisdom tooth that's typically not there. Okay, so come back down here. The way I want you to envision it is as if you're going to take a mouth and have it around. Okay, so I'm actually going to take it this way myself. And I am going to kind of draw a mouth on there in the middle. Okay. Okay. That is kind of where you'll trim, where you'll put the holes. That's as if the mouth. Now it stretches, right? See how big it stretches? It stretches everywhere. Okay, so when you're doing this, you want to envision that circle and 7 dots along it as you go. Okay, so I'm actually going to get a second rubber dam out and show you the dots. Now that you've seen that circle. The new one, you're going to kind of follow that circles with dots. So I'm going to do 7 dots as we go. So actually here's the 2 centrals about that far apart. And then lateral, canine, premolar, premolar, molar, molar. Okay? Okay, we've already did the lateral, central, central, lateral, canine, premolar, premolar, molar, molar. Okay, so there's about how you do the top. Now I went down a little far. Typically we'd want those to be in the middle and up. Okay, so now I'm going to do the bottom. We got molar, molar, so we go molar, molar, premolar, premolar, canine, central, 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 well, lateral, central, central, lateral, canine, premolar, premolar, molar, molar. Okay, so see, all I did is I just kind of drew that fast. So if you want to, you can draw those on there before you trim and do your rubber dam. Or you can draw a circle, right? Or you can draw the circle like that, and then know that's kind of where the mouth is. So this shape's like that in the mouth. So this is the maxilla and mandible, maxilla and mandible. And all you're going to do is take this. Now I'm going to put this on tooth number 14. I've got my fake mouth there, my typhodont. That's the one you're going to practice on. And I'm going to try it on tooth 14. Maybe we'll show you. Matter of fact, we'll do 14 and 9. Okay, let's do 14 and 9. So as I come to this one, okay, 14 and 9, I'm going to punch out those holes. So 9 is this central coming right in there. Okay, so can you see? I'm just punching on that central hole, number 9. Okay, I just punched a hole in it. Okay, so number 9, and then we're going to come down to 14. So 10, 11, 12, 13, 14 is that one back there. I'll punch a hole in that. Now, as you've worked with me on root canals, you know that I don't punch holes or I don't draw circles because I've done, I don't know how many thousands of these, 20,000 of them or so, and I just know where the holes are. But if you want to draw holes, fine, go ahead and do it. Okay? So now we're going to do number 14 first. Okay, so I'm going to bring that one over, and what I'm going to do is I'm actually going to fit that. Can you guys see? I'm going to fit that. Now this goes to the back, okay? The big guy goes to the back, because if it's in the front that way, it's going to be in my way when I'm working. So that goes to the back, and if you look, the skinny side goes towards the inside, right? So the big thing goes to the back, skinny side comes to the lingual in front. So when I do that, I'm just going to get it, and I'm going to stretch the hole, put it around that wing. I'm going to stretch that hole and put it around that wing. Okay? So there it is. Okay, now it's ready. I'm going to take my clamp. I'm going to put it in the 2 holes, and I'm going to stretch them. Now I'm going to come to the mouth, and look at me. I've oriented my body to the way it will be in the mouth. Now when I'm this way, this is how it'll be, right? So I'm going to have to come in this way. So I'm just going to do it that way. We're going to come in. And I'm going to find 14, right there it is. I'm going to come up 12, 13, 14, and I'm going to slide that just on like that. Okay, and I'm out. Alright, once we've done that, where is it? The one tool I need isn't up here. Yeah, there it is, okay. So once I've got it on like that, now I need it to fit snug. So I'm going to come in with my PFI, and I'm going to stretch that and scoot my, can you guys see that little thing there, the 2 of you? See that little guy? I'm going to stretch that right there, and I'm going to bring it down. Okay, now it's nice and snug. I'm going to do the same thing back here. I'm going to stretch that, and I'm going to bring it down underneath. Okay, that rubber dam is now on and ready to go. That tooth's isolated. I can come trim and do my root canal. Okay, now let's switch. I'm going to take that off at the end. When you guys do it, I'll have you take the rubber dams off as well. You'll take that off. Okay, and then this just comes off. Let's go ahead and do that anterior one. We cut it for number 9, if you remember. Now, let's see, where'd I put the... It's actually a different one I like, but I think we lost it. So this one will work, but I like a different one that has the little clamps that come out, little wings that I can put it on. You know, like the little wings. That has wings that I can wrap it on. That one has no wings, so guess what? You can't do it the way we did. So this time I'm just going to put this around the mouth. I'm going to find tooth number 9. I'm going to find my hole, and I'm going to stretch it between. Okay? Stretching it between. See how it is? I'm actually going to hold that with my finger there. I'm going to come to this. I'm going to put the fat side towards the tongue. And I'm going to pick it up. I'm going to leave that there for a minute so I can get this. I'm going to pick it up. That's how you get a hold of it. Okay. See how you do that? Okay, now I'm come back to my tooth. I've already got it between it. I'm going to stretch it, and I'm actually going to get that to fit. I'm going to pull that out. And this comes all the way down. And the same on the front, all the way down. Okay, and then I literally, see I pushed it, I just pushed it down into place. Okay, and that's covered. Now the front, I cut it because I'm trying to use my assistant typically to help you too, but I did cut that a little bit. I still got it all down, but didn't do it, I cut it. That's okay. And as a matter of fact, you could leave it just like that. Now, see how it's kind of bulging out in the front? I'm going to just actually floss that. See how that went down? Just flossing it. I'm going to floss in there. Oh, went back down in. I floss that there. Kind of pushed it down in. So in the back, as you look in the back, that's what I need. I need to have that view. I don't really care what happens on the front, so the fact that it cut it there, I don't care. But that's the view, okay? I actually want you, and that's it. Now you got your both rubber dams in. You're done. You're ready. See, there's my other lines. See, they're right in the middle they are. Okay, so that tooth's now ready. It's going to be in the bath about like that, and I'm going to come do my root canal through the back. Okay, back up to me. So that's how you do rubber dam. Really simple and easy. Anterior back, the premolar is just like doing a posterior one. Just a matter of which clamp you use. But that's how you do it. I want you actually to do 10 anterior and 10 premolar or molar. Those could be the same, but I want 10 anterior as well. So you're actually going to do 20 rubber dams. You can do it fast, they're easy, but front's a little more difficult, so I'd like you to get 10 of those on too. Okay, good luck placing those rubber dams. Go get them.
Some bright morning when this life is over,